My grandmother, who lives in the Philippines, was diagnosed with colon cancer in March this year. And I didn't even know until my dad, who works in Europe, told me by text a month later. So I visited her, and she couldn't bring herself to tell me, even when she smiled and held my hand and took photos. She was always so bright and full of life, and the illness just left her always tired and hurting. And I know that she lived a good life and that she's old now, but do her last days have to be so painful? Is it just inevitable?
Was there any way we could have avoided this?
During the COVID-19 pandemic, the world's need for quality healthcare has spiked. We have seen that technological advancements have been rapidly pushed forward in these trying times. We envision that in the upcoming years, modern technological advancements will be put into healthcare more and more.
The current healthcare system is fairly inefficient. For example, MRI scans need to be read by a specialist in order to identify tumors, fractures, and other anomalies in the body. However, with the help of computer vision AI, it could effectively detect these anomalies and make the specialist's job easier. On another note, patients have to wait hours in an A&E before receiving any treatment. By using a centralized healthcare system, it could drastically reduce this waiting time by linking patients to the specialists and distributing the load between hospitals.
As such, we envision that in 2032, the UN will propose a set of policies called Model H in order to effectively manage healthcare. This would include the implementation of more advanced IT systems in hospitals, as well as the centralization of health systems. This would allow collated health data to be used for research purposes in a secure space. Then Singapore would implement the MHSI, the Model H System Initiative, under MOH in order to adhere to these policies, alongside streamlining staffing and patient assignment.
With more data, medical researchers will come to find that pollutants such as microplastics end up staying in the body for long periods of time. This will increase the risk of cancer. In 2042, the WHO, UN, and NUS will come together to conduct a large-scale human trial to find an effective way to eliminate these microplastics and the leading cause of death. With advancements in research, we are able to commercialize the medical implant. The medical implant can take a user's health data in real time and provide feedback. This is compatible with the Model H's IT infrastructure, which gives medical providers more accurate data. The first model to be mass-produced is the Micro-P-Pill version 4, which is the result of a 20-year study completed in 2062.
With the commercialization of the medical implant, medical data is easy to collect at a large scale. This will help to speed up cancer research as researchers have more data to spot early signs of cancer. The implant will be the size of a grain of rice and will be outfitted with the mechanisms needed to detect bodily vitals along with the concentration of microplastics in the body. The implant will also transmit information through NFC and low power encrypted ultra-wideband transmission. Since cancer could be treated at its early stages and the chance of survival is much higher as early stages, we believe that this technology could help many people detect early signs of cancer and get early treatment, thus saving many lives.
As our mentors have never failed to mention, predicting the future is hard. Our future scenario could unfold like a prophecy, or it could be reduced to a fantasy, like many others before it. But our solution is more than that. The story is our passion. The technology is our ingenuity. And our ideas, the drive to shape our dream into reality. A better world for us and those to come.